Welcome to our webinar on the findings from the Healthwatch Lincolnshire Menstrual Health Survey. Firstly, my name is Dean O'Dell. I'm the Contract Manager for Healthwatch Lincolnshire. And we are thrilled to have you join us today as we kind of delve into the results of this survey and discuss the implications for improving menstrual health across our communities. This webinar is kind of part of Healthwatch Lincolnshire's campaign strategy for the year, which began with a dedicated focus on menstrual health, recognising the importance of this often kind of overlooked aspect of health. And we launched an extensive survey to kind of gather insights and identify gaps and ultimately kind of drive actionable change to the support individuals' health needs and support also the ICBs, the integrated care boards, work around women's health and the Lincolnshire Women's Health Strategy. So before I sort of hand you over to Hannah to present these findings, as I said, this is one part of our kind of annual campaign plans. So just to give you a little bit of a flavour, we're just about to close our survey on respiratory conditions. We have launched a piece of work now on neurological conditions, and later in the year, kind of between October and December, we are expanding our efforts to kind of include targeted mental health initiatives, looking specifically at communities such as farmers, first-time dads, and military personnel and veterans, each of whom face unique kind of mental health challenges. So if any of those areas do pique your interest, we would love to work with you on this, and we'll also be doing a similar sort of webinar on each of these areas, presenting the findings in this way, but also to provide you and others the opportunity to contribute. So please do get in touch, and we're happy to send more information about that after today's webinar. But in terms of today's webinar, as I say, we'll provide an in-depth look at the menstrual health survey findings, and what we want to do differently sort of moving forward is to provide this platform and this opportunity for you to sort of highlight work that has been done to improve services and experience, but also what needs to change and steps forward and sort of recommendations. So there is a little bit of homework where we would ask you to provide us with any of your thoughts on these findings, but also about highlighting what you're already doing in this space to provide, to improve women's experiences in Lincolnshire. So thanks again for joining us, and I see a few of you are already using it, but please do use the chat feature to introduce yourselves, and also there'll be an opportunity for sort of questions at the end, and also to provide those kind of sort of updates and sort of forward actions. So now I will hand you over to our Research and Insight Officer, Hannah Darley.
Thanks, Dean. So as Dean said, I'm Research and Insight Officer, and I've been involved in kind of planning the engagement, to carrying it out, and now to analysing and presenting the results. So just to kind of carry on from what Dean said, we focused on menstrual health for the first quarter of 2024 as part of the government's women's health strategy. Each ICB will have a women's health hub, and it's hoped, just a small role of these hubs, it's hoped that it will improve diagnosis and treatment for conditions such as endometriosis, polycystic ovary syndrome, and help those going through menopause. And currently, little is known about the experiences of those in Lincolnshire who have menstrual health conditions or going through menopause. I know some people on this call are doing some great work on menopause as well, so we kind of wanted to try and support that and see what everybody else's experiences are. We primarily focused on endometriosis, polycystic ovary syndrome, and menopause, but we welcomed feedback about kind of other conditions such as fibroids and premenstrual dysphoric disorder, known as PMDD. And we wanted to make sure we were hearing from both service users and health and social care professionals who may also be service users themselves, to make sure we got kind of a balanced picture. So how did we engage with people? So the main form of engagement was an online survey. However, paper copies were also available on request, and some of our team members, as they've been out and about at outreach clinics or visiting, say, groups for supporting those with learning disabilities, they also took the survey there and spoke to them about the work to make sure we were kind of reaching everyone. People who may not want to or can engage online were also included. And we also conducted 4 online focus groups with a range of health and social care professionals. And I know some of you who are here today attended those. So thank you very much again for coming to those and coming back today. So both forms of engagement covered the same area. So it was diagnosis, medication, treatment/condition management, waiting times for kind of other tests or treatment, and accessing emergency care if needed. So who shared their views? So we were really pleased with the response. We had 450 service users shared their views. The majority of those came through online, but we did have some kind of come through as we were out and about. And 18 healthcare professionals shared their views, and they kind of were split across the system. We had people from primary care, people from LPFT, people from LCHS, which was a great mix. So what did people share their views on? So it was a good split. It was menopause and perimenopause mainly, but we also heard from people with PCOS, endometriosis, and the other group included people with fibroids and PMDD. We also heard from a range of people in terms of demographics. So we heard from people who are carers, who consider themselves to be neurodiverse, people who work in the health and social care system, veterans and currently serving personnel, and farmers. And there's a slide at the end with a more detailed breakdown of this. So I'll go over that then. We do want to acknowledge that the experiences shared may not be fully representative of all those who experience kind of care for menstrual health conditions or menopause in Lincolnshire, but from our findings, the kind of overwhelming sentiment is very much the same. So let's get into those findings. So I'd like to thank everyone who took the time to share their views and support the project work, whether that be through completing a survey, emailing us with kind of different experiences or the work they're doing, and a special thanks to Jodie, who I think is here today for helping us facilitate the focus group. So common themes persisted throughout the report, spanning all the different kind of conditions and areas, and the same issues were raised by both service users and professionals. So what was that? So when looking at diagnosis, the most common thing we heard was that symptoms were just dismissed. People would go to the doctor with kind of different symptoms, whether it was relating to their period or suspected going through menopause, and it was just, oh, that's normal, or oh, it's not that big of a deal, it's your age, that's what periods are like. And that's not something that people found obviously very helpful, because they would go get told this, go home, and then not really be in any better way off because they haven't been given any help. Again, generally there was found to be a lack of knowledge and interest in the symptoms, both kind of physical symptoms and the mental symptoms of mental health conditions and going through the menopause, and also a lack of acknowledgement of the impact they can have, kind of not just dismissing them as, oh, you've just got to live with it. For some people it was really getting to a point where it was ruining their lives. In a similar vein, people just didn't feel listened to and they felt ignored. They knew their own bodies and what was normal for them and the impact it was having, but they would feel that it was just, well, no, you've got to carry on. Long waiting times was also a big issue, particularly for endometriosis. We heard from people who, frequently were waiting 10+ years to be diagnosed, and in that time, they weren't getting any support. People with PCOS tended to share that they were diagnosed but then left without any support or care. And there were also issues raised in terms of inequalities in the access and use of blood tests to diagnose menopause. So people would say that, oh, my doctor or nurse sent me for a blood test, I was diagnosed. Somebody else in the same PCN said, well, I wasn't, and it was kind of just guesswork, or it was just put down to something else. And these are just 2 quotes that from so many that I think really kind of do a good summary of what people were saying. So my concerns were definitely not taken seriously. I felt like I was not believed and completely dismissed. I was in a lot of pain and nothing was done. Made me feel like I was imagining my pain and was convinced there was nothing wrong with me. And that was someone who was later diagnosed with endometriosis. And the diagnosis took approximately 10 years. My problems were continually dismissed despite me taking time off school and university and work. The diagnosis was only made once I finally had diagnostic surgery. And again, the endometriosis had caused considerable damage. And that was again something we'd heard, particularly for endometriosis and PCOS, that by the time people have got diagnosis, their condition was already in more advanced stages. And I fully appreciate that diagnosing endometriosis is very difficult and you have to rule out lots of things first. But I think some people just feel very lost during that process of either not really knowing what's going on and not really having any support to cope in the meantime. GP also shared their view kind of more broadly about menstrual health and menopause. And they were saying kind of the classic thing is that women don't necessarily know it's a problem. They don't necessarily know that what they're experiencing is, in quotes, kind of abnormal. So they don't tend to ask. And then going back to that thing of when they do ask, the response they get tends to be mixed. So sometimes they'll go and somebody will be really supportive and listen to them and really push for them to kind of get the support they need. And other times, unfortunately, that's not the case. So they're then put off from going back. And this GP kind of went on to go about kind of the real variability and kind of inequalities in the support that people probably get at the moment. So next we kind of talked about treatment and condition management, and genuinely people felt that, you know, when they got medication, that was great, particularly for HRT, you know, it often really turned their lives around, but there was little kind of other more holistic support to go with that, particularly around the mental health aspect, which I'll touch upon in a minute. So some issues relating to kind of medication for perimenopause and menopause, it was access to HRT, which obviously has been kind of a national problem, and hopefully now things are kind of resolving. PCOS, inequalities in access to metformin was an issue. So somebody shared their experience where they recently moved into Lincolnshire, they were on metformin in another area, but then they weren't being prescribed it here. And some people, again, because of the lack of support, had resorted to Google and it says about metformin, and then they would go to their GP and the GP said, well, I personally don't think that's probably appropriate for you. And obviously that kind of creates that imbalance in that person's mind of thinking, oh, well, the NHS website's saying this, but, and again, it's just, I think about managing kind of expectations. Endometriosis, the difficulties in accessing appropriate and local care was raised. People were showing experiences of having to go to Sheffield or Birmingham or even further afield. And often when you're in excruciating pain, they found that quite difficult. So moving on to the next section of the survey, that really was about waiting times for kind of additional tests and treatment after that initial diagnosis. And the same kind of issues, regardless of the area, are raised. And that was the length of time of waiting for referrals or specialist endometriosis support, that kind of lack of communication whilst waiting. So people didn't know if they were on a list, how long they would need to wait, or if there was anything they could do to wait well. And some people felt that obviously huge pressures on the system at the moment, but the amount of pain and kind of the mental aspect of things, people just felt like it wasn't being treated seriously, which kind of leads us on to mental health. And this was also a really kind of huge theme that came out of the survey, kind of organically from people sharing their experiences. And it was that currently people felt that there wasn't really a great understanding or acknowledgement that the impact these conditions can have on your mental health, whether that be from the symptoms themselves being unmanaged and kind of having to wait a lot to get support or difficulties getting support. So we also had a lot of people from LPFT who attended the focus groups, which was great. And they kind of echoed this, that there needs to be more research in this area and that they too now are starting to kind of link menstrual, menopausal and mental health together to try and improve kind of patients' experiences. And this was a quote from a lady who attended the focus groups, and she'd worked kind of with young girls and kind of through to adults, and saying that how she was surprised herself that she hadn't really thought about it. And it was only having kind of experiences in her personal life that she then started taking that into her work. And I know now that LPFT have been very kind of proactive in the work they're doing around menstrual and menopausal health. So what works well? There were some positives. I think just unfortunately they tended to be a bit kind of spread throughout the county. It didn't seem to be very equitable, but people who had good experiences shared that it was mainly down to having quick and easy access to appointments, both at primary and secondary care level, being listened to. Somebody said just actually going and being able to talk about something and somebody going, yeah, okay, I understand that, that in itself was helpful. Interested, knowledgeable and supportive professionals. Again, obviously GPs can't know everything about anything, but I think if people could then be directed maybe to someone who does, that would again help people. Being referred when needed, responsive, proactive care, having follow-ups and reviews, and again, the work done by LPFT to consider menstrual, menopause and mental health. And a lot of the professionals especially really praised the work of the ULHT Menopause Clinic and how that had helped them personally and how they hoped that maybe it would be able to be expanded. So on the flip side, what could be improved? Much of what I've said already about making sure people are being listened to and taken seriously, more education around menstrual health and menopausal health, even if it's maybe directing someone to a particular nurse at a surgery who has that kind of interest, quicker access to diagnostic tests, greater awareness and acknowledgement of the impact these conditions can have on menstrual health, and more emotional and well-being support for these conditions. And a suggestion that really kind of links in well with the ICB's plans around the Women's Health Hub is that people really did seem to value the idea of being able to go somewhere where they can have all this information about menstrual health, somewhere that they can direct queries to that don't warrant a GP appointment and don't go down the rabbit hole of Google. Another interesting suggestion was around public health messaging, more around the signs and symptoms of, say, the menopause, and making sure that information is written by people who are currently going through the menopause, and that this should be for everyone and not just targeted at those in that stage of life. There were some condition-specific improvements. Endometriosis, by far the biggest thing, was more localized and specialized support. Menopause was the less kind of rigid diagnostic criteria, something we heard a lot with people saying, I was told I was too young, or that I shouldn't be going through that yet. And people didn't really find that necessarily helpful. And then in a few years' time, they would then be, oh, well, you are going through the menopause. And for PCOS, it was more sensitive and realistic weight management support. We heard a lot about people being told, oh, yeah, I need to lose weight. And a lot of them are very aware that they need to lose weight, but they don't feel currently that it's kind of supported to actually help them do so. So what are our next steps? So as a result of everyone sharing their views, we've produced a draft report, which I'm sure Dean will kind of go into a bit more about. We'd love you to kind of have your opinions in there as well. And we've done this presentation today. And once we've kind of got that rounded view of what we found, the other work that's going on in the system, any comments, we'll then share that publicly for people to look at. But yeah, so this is just a quick breakdown of who shared their views, because we really wanted to make sure we were hearing from everyone. Luckily, kind of experiences didn't seem to differ by certain groups. So those who were carers tended to have a very similar experience to those who weren't. It tended to be, unfortunately, a very kind of poor experience across the board. But yeah, I think that's everything from me. So thank you very much for coming and thanks for listening. I'll head back to Dean.